Good afternoon, everybody. This is the seventh annual Mental Health and Addictions in Construction webinar. First off, want to thank our sponsor, Sherrard Coos, for supporting this important webinar and discussion. And then today we've got a great agenda with three cabinet ministers, and I'd like to thank Minister Tabolo, who's here with us today. I think he's participated in all seven of these events. And when you look at his record, nobody's done what he has when it comes to mental health. He gets construction, he gets the issue, and more importantly, he takes the time and dedicates his time and resources to this issue. So, wanted to do a very specific thank you to him, as well as all of the other speakers we're going to have from across the construction industry and mental health providers. A big quick thank you to the RESCON Health and Safety Committee, as well as the RESCON staff, Meredith and Yasmin, and the speakers. This event is designed to be a check-in and a placeholder to ensure that the conversation and efforts keep on going and continue. So today we're going to focus on where we're at. We'll do that check-in, where we're going, and how do we make very specific improvements with the goals of really understanding why this is an important issue and why this issue isn't going away. This needs to be on our agenda all the time. The second goal is really, what does help look like? And what we're trying to do here is get to anybody who might be watching this who is thinking, do I need help? And really starting to understand what that help looks like. But we also want to support the individuals in the construction industry, and there's lots of them that support the individuals that do need help. And so I'm talking about whether it's a union rep or a foreman or a super or somebody in HR or really anybody who wants to step up and provide assistance where it can be provided. We also want to focus on best practices, and with that in mind, we're going to have a presentation from one of the ResCon members named Multiplex, and they've made significant investments in this space, and we really want to be able to showcase what they've done and see what can be learned and applied. So today we understand that we're speaking to the converted, and we do want to thank everyone for the meaningful work that they do every day. And this webinar is designed for you, one, to recognize the work you're doing, to figure out where we're at, but then also provide hopefully the resources that you need to keep doing the good work that you're doing. And so as a result, every time we do a webinar, we collect a ton of resources and we will get them out to everybody. We'll get a recording of this out to everybody. But if you've got good resources, put them in the chat or send us an email and we'll make sure that we include it in the package. We are going in the right direction, but we still have a long way to go. When we started this 7 years ago, it was tough to even talk about mental health. And now, and you'll see with the agenda, we're really diving into it. The one issue that is still apparent is, especially within construction, where everybody wants to seem tough and everybody wants to seem okay, there seems to be a recognition that mental health is an issue. And it's okay for other people to have mental health issues, but people are still less willing to admit that they might need help themselves. And so when we started this, we used to use the Bell Canada stats. It was either 1 in 2 or 1 in 4 people will be impacted by mental health in their lifetime. Going through the pandemic and understanding the construction industry, if you've been in the construction industry for anywhere from 5 to 10 years, it's 1 to 1. You either are impacted by it, someone who's impacted by it, or you're just not being honest with yourself. And so I think that's a big thing that we're trying to take. It's just like physical health. Construction's tough, and injuries do happen, whether it's physical or whether it's mental. I do want to recognize that there is an opioid issue, and it is impacting construction more than it is impacting other sectors. And as a result, we do have the IHSA and Kathy Martin speaking today, but at all IHSA meetings, what they do is they pause and they take a moment of silence to recognize the fact that injuries are getting, injured and killed at work. And so I want to read out kind of what is read out at every IHSA meeting. And for those able, I'd love for you to stand and take a moment of silence. So at every IHSA meeting, we say this at the start to take safety seriously. So an Ontario worker will die from a workplace injury or occupational disease today. Let us join together in a moment to honor the lives impacted and reflect on how we can ensure every worker arrives home healthy and safe. So if you can stand and take a moment, we would appreciate that. Okay, thank you everyone for that. And so to keep it on schedule, our first speaker is Kate Cowan. and she is the Director of Training, Awareness, and Prevention. She's going to be here on behalf of the Chief Prevention Officer and the Prevention Office. Kate has an amazing background and an amazing bio, so I'm only going to touch on a couple pieces, but she has spent time with the Institution for Work and Health. She spent time at Treasury Board within education and within labor, and so she has dedicated herself to prevention, but to health and safety. And so please, Kate, I'll give you the floor, but thank you for all of your efforts.
Thank you, Andrew. Nice to see you today. Good afternoon, everyone, and it is an honor to join you today. So, yes, Joel does send his regrets today. He's asked me to step in on his behalf. Today's symposium has some incredible speakers lined up, and I wanted to take a moment to thank Associate Minister Thaniga Salam and Associate Attorney General Tibolo for being here and for their ongoing commitment to mental health and wellness in our communities. So, we're here to talk about something today that often stands behind the scenes in our industry, and that's the mental health of construction workers. We build the foundations of cities, but we must also build foundations for the people who make it all possible. So, construction, as you would all know, is one of the most demanding professions, physically, mentally, and emotionally. And there are some statistics that I will share with you from Ontario and Canada. So, 1 in 3 construction workers report poor mental health. 83% have experienced moderate to severe mental health issues, including depression and anxiety. Suicide rates in construction are 53 per 100,000 workers, which is nearly 4 times the national average. Suicide deaths outnumber workplace accident deaths by almost 4 to 1. And in 2020, 2,500 Ontarians died from drug overdoses, and 30% of those were construction workers. So, why is construction so affected? Long hours, job insecurity, seasonal work, and a culture that often values toughness over vulnerability. So, when nearly half of workers report depression or anxiety, it's not an individual problem, it's an industry challenge. Historically, mental health has been stigmatized in construction, and workers often feel pressure to push through rather than seeking help. But the silence is costly, impacting safety, productivity, and lives. So, what is the message here? Mental health is not a weakness, it's a work site safety issue. It's as critical as all the other hazards and incidents that we look to prevent. So, what do we know that's working? We do know that peer support programs do work. Workers trust other workers. Programs that train peers to recognize signs of distress do, in fact, make a difference. We also know that employer initiatives are working. Companies offering employee assistance programs, so EAP, mental health days, and confidential counseling can also make a difference. We know technology also offers some benefits. There are apps to check mental health check-ins and anonymous supports to help and start the conversation. And these efforts matter because 77% of tradespeople experience stress, 62% report anxiety, and 50% report burnout. And we need solutions to meet them where they are at. So there's a call to action for everyone today. So for employers, we're asking for you to make mental health part of your safety culture. Toolbox talks should include mental health and encouraging speaking up. If you're a worker, particularly in RESCON where it's all about the team, speak up and check in on your crew, asking, are you okay? You can save a life. For industry leaders, we request that you advocate for policies that prioritize mental health resources and addiction recovery programs. And stats show that 25% of tradespeople use substances daily or weekly to cope, and we need to address root causes and not just symptoms. So in closing, the numbers tell us this is incredibly urgent because 1 in 3 workers struggles with mental health and suicide rates are among the highest of any industry. Let's commit together to not just building the structures, but also a culture where every worker can feel supported and safe. And together we can lay a foundation for a healthier future. Thank you.
Thank you very much, Kate, for that wonderful keynote address and for stepping in today. I think you offered some valuable statistics as well as really highlighting the key that mental health is not a weakness and we need to look at it as a workplace health and safety issue. So thank you very much again. And I think that was a perfect start to our next keynote speaker. So next we have a video from the Associate Minister of Mental Health and Addictions, Minister Vijay Thanigasalam. As Associate Minister, he has publicly supported and overseen several government initiatives to expand access to mental health care and addiction services across Ontario. So we will play his video now.
Good afternoon, everyone. It's an honor to speak with you all today at the 7th Annual Mental Health and Addiction in Construction webinar. On behalf of Premier Ford, the Deputy Premier and Minister of Health, Sylvia Jones, and the entire government, thank you to the Residential Construction Council of Ontario for hosting me today, and thank you for your unwavering advocacy for improving the state of mental health and addictions in the construction industry across the province. Our government is committed to ensuring that Ontarians have the access to world-class mental health services, and building a comprehensive and connected system of mental health and addiction services is a top priority for our government. Under Premier Ford's leadership, we are making record investments in healthcare, and we recognize that mental health and addictions are critical challenges impacting workplaces and communities. That is why our government is taking innovative and decisive action to ensure people and families across the province can access the right care, treatment, and support when and where they need it. The Roadmap to Wellness is our government's 10-year, $3.8 billion comprehensive plan to establish a world-class mental health and addiction system right here in Ontario. We are building the provincial framework that adds capacity to meet the demand for services, fill gaps in mental health and addictions care by expanding new services to better support the needs of people with mental health and addictions challenges. Through the roadmap, we are tackling mental health challenges head-on. Our government has invested more than $800 million in new base funding to support a range of initiatives such as community mental health, supportive housing, Indigenous addictions, and mental health. As part of these efforts, Ontario continues to support programs like Mental Health First Aid, which equips people with the skills to recognize the early signs of mental health and substance use challenges and connect someone to the right care. We are also expanding to free naloxone kits across the province through the Ontario Take Home Naloxone program, helping save lives by preventing opioid overdose deaths through community-based and workplace training. We are also establishing mobile mental health clinics to better meet the needs of Ontarians in remote communities, expanding peer supports, non-police mobile crisis services, and the Ontario Structured Psychotherapy Program. Ontario Psychotherapy Program is an evidence-based, publicly funded psychotherapy program providing accessible treatment options that are matched to clients' needs. And since its launch, the Ontario Structured Psychotherapy Program has seen more than 100,000 clients enrolled who were provided care with no out-of-pocket cost. And we continue to increase investment in supports and initiatives aimed at helping people with mental health and addiction challenges that are at risk of homelessness. To address gaps in care and meet the increased demand for substance use services, we are investing almost $550 million to establish 28 homelessness and addiction recovery treatment hubs, or HOT hubs. Through HOT hubs, we will attach vulnerable people with complex needs to a holistic approach to treatment and care, helping ensure vulnerable people connect to high quality care where and when they need it. And we are creating a care continuum that includes mental health and addiction services and support, as well as social services, employment support, and supportive housing. HOT hubs will also add close to 900 highly supportive housing units in addition to addiction recovery and treatment beds, which will help vulnerable people transition to more stable long-term housing. Through HOT hubs, we are adding more to help people with their recovery, break the cycle of addiction, and build healthier lives. It's another way we are taking a significant step towards improving access to comprehensive local mental health and addiction services to create and expand more mental health and addiction services, ensuring individuals, families have timely access to appropriate, high quality care. Thank you again to the Residential Construction Council of Ontario for the opportunity to speak with you today, for organizing this great event, and for all that you do to address mental health and addiction challenges in Ontario's construction industry. We are taking real, tangible steps to improve the state of mental health and addictions among the province's construction workforce. Thank you for allowing me to address you today.
Thank you very much, Minister, and we look forward to all the great work that you're going to do in that portfolio moving forward. Next, we have video remarks from the Minister of Labour, Immigration, Training and Skills Development, Minister David Piccini. Minister Piccini is a strong advocate for the skilled trades and linking that with mental health supports for labor. So thank you again, and we will play that video now.
Hey everyone at RESCON, thank you for inviting me to share a few words. I'm David Piccini, Ontario's Minister of Labour, Immigration, Training and Skills Development. Behind every project, every construction site is a father, a mother, a son, a daughter, and their mental health matters. In construction, the pressures are real. That's why our government is breaking the stigma, investing in mental health supports for workers across Ontario through programs supported by our ministry, like presumptive WSIB coverage for PTSD for firefighters, trauma-informed training for frontline workers, and peer support programs. We're helping workers get the tools and the care they need to stay healthy on and off the job site. I want to say a special thank you to RESCON for your continued leadership, for putting workers first. Together, we're building a culture of safety that includes mental health. Because a workplace that is a healthy and safe workplace is a productive workplace.
Thank you very much, Minister Piccini. We will now move forward with Minister Tabolo, who is the Associate Attorney General. He is also the former Associate Minister of Mental Health and Addictions. So we are very lucky to have him here today. And if I remember correctly, he was the first minister to take on the mental health and addictions portfolio. So he has championed many investments and reforms in mental health and addiction services and continues to be very passionate on this file. So I will pass it over to him now.
Great. Thank you very much. And it is a real pleasure for me to be here once again. I think this is the seventh. I've been to pretty much every one of the conferences, seminars that you've put on. I'm really happy to participate in this because RESCON has taken a leadership role in ensuring that systems are set up that provide low barrier access points to people that are in need of supports, whether it be mental health or addictions. I've been a little bit out of touch with the statistics, so I appreciate Kate's statistics kind of updating me. I knew that we'd had a loss of approximately 500 construction workers as a result of overdoses with opioids, and knowing that it's now gone up to 750 is troubling. It's disturbing because it means that this is a problem that persists and that we need to take responsibility in terms of how best to approach the issue to provide better supports. My colleagues spoke passionately about the work that we're doing as a government in trying to build a system, but a system is only as good as its parts. And in a lot of cases, what we found when we first started with this ministry was that everything is very much siloed when it comes to the provision of services. We discovered that it was very difficult to attach those pieces because not only were the silos existing in community, but they existed in government as well. And if you heard the Minister Piccini just now and Vijay, both of them were talking about the kind of investments that we're doing, and they are pulling together and making sure that we're addressing these issues in each of the ministries to ensure that the resources that are there, that are limited, are utilized the best way possible. But utilizing those resources to prevent overdoses today and to ensure that a system exists to be able to care for individuals, whether it be treatment centers that are based in the community, which is what our government believes in. We believe in a model that allows the individual to get the care they need within the system or within the community. That means withdrawal management, it means treatment, and it means support afterwards, subsequent to the treatment. To do that, you need to make investments within a primary care model. You need to partner up with organizations that understand the importance of providing those supports and services. And of course, there is the tertiary care that we get through hospitals that should be left for the most acute cases. By doing that, one of the things that while I was the minister, we found that we were able to flatline the need to utilize emergency rooms for the care of individuals with a mental health issue or an addiction issue to pre-pandemic levels. Now, that's substantial because it means that we start right-sizing the healthcare system if we utilize and build community-based care. And as you heard, the heart hubs, the addiction recovery fund that I was responsible for, between the two of them, will have online in excess of 65,000 treatment spots, not beds. Beds, I think we come in at somewhere like 1,200 beds, but because of the rotation of those beds and the use of them, they generate 65,000 actual treatment spots. And that's really important because when a person says they need help, they need to get that help when they ask for it. It's a very small window when a person can actually receive the care and the support that they need because they recognize that they need it. But the other part of this that is really important, and I want to emphasize today, and again, I emphasize it as the Associate Attorney General, justice is the flip side of health. If the healthcare system is having difficulty dealing with issues relating to providing supports and services, it's the same issue on the justice side. People don't get into trouble because they've got nothing better to do. They get into trouble because there's underlying circumstances that lead to that. And while in the construction industry, most people have jobs or they have jobs and are able to work, there is that period of time that they're not working. And what are we doing to support the individuals to ensure that they have the support they need? So from my standpoint, the most important piece of this puzzle is what can we do with respect to education and prevention. Education and prevention means that we need to build into whatever programs we have, whether it's through the unions and the creation of new carpenters and millwrights and masons, providing them an understanding of what an underlying mental health issue is or how to deal with pain and manage pain where we're not needing to rely on opioids. This is something that's extremely important. So some of the programs that I've seen, I commend the unions and the organizations for putting in place these programs to help a person become more resilient. The best and the cheapest way to deal with an addiction is to prevent it. The best way to deal with a mental health issue is to address it as early as possible. And I always refer when I speak to this, it's not just about educating the construction worker. It's making sure that those resources are also available to the family. Because at the end of the day, when the individual goes home, he still goes into an environment that needs to be supportive, that needs to be decompressing in nature. And so what are we doing to support the family unit? Because again, if a parent is coming home and is dealing with his own or her own complicated issues, how does that affect trauma in the family, the youth? And what are we doing? Are we providing the resources that are necessary to make sure that we're not perpetuating a mental health issue based on trauma or issues within the home? So it's very important that those issues are addressed as well. And I'm glad to see that the conversation is taking place. In addition to that, how do we prevent mental health issues, or how do we prevent an addiction? Again, it's investing in education. It's providing the supports necessary to ensuring that the individuals get the support and the care they need. I used to always say as the minister, mental health is health, and you cannot have a healthy economy without people having mental health and health. And so we need to address this and attack the problem from all the different perspectives. And that means looking at it from the standpoint of what we do by way of education in training our individual, our workers, the people that are doing the actual work. What are we doing to inform the people that are overseeing and supervising the workers? What are we doing to ensure that the family is safe and supported? What do we do in order to ensure that policies that are developed by government have these issues addressed so that we have everyone working together and coordinating a response to these complicated problems? With that, I want to just wrap it up by saying thank you for listening. Thank you for continuing to include me in this opportunity to speak. I am very interested and very passionate about this issue because, again, low barrier access to providing supports and services to individuals, I find that that is the best way to deal with the problem. And the more we talk about it, the more we provide opportunities, low barrier opportunities, access points, the less mental health is stigmatized and the more it becomes a direction or something that's very resolvable. And mental health and addictions are things that can be addressed if the resources are put in place to address them. So thank you so much for the opportunity, and I look forward to coming back next year.
Yeah, absolutely. And we might even try and plan the webinar around your schedule. And so thank you for all your efforts when you were the minister responsible for this. But I mean, I don't think you'll ever stop being responsible. I don't think you'll ever stop working on it. And just being able to work with you, but to learn from you and to see your dedication, it's quite inspiring. And so we really do appreciate all the efforts you've made. And even just to let all the attendees know, we start these webinars a little bit earlier, and Minister Tobolo, he's always interested in learning what other people are doing and what practices he can take back and share with other groups. And so the pre-chat or whatever, it was about people kind of highlighting what they were doing, and Minister DeBow saying, okay, good. And I need to know more about this because I want to take it here. And so I don't think you ever take a day off. And we really, really do appreciate your efforts and we appreciate you taking the time. So thank you very much. Great. Okay. So with that, we're going to move to our first panel. And so this panel, we'll just call it the state of mental health in construction. And we've got three great speakers. I'm going to do a terrible introduction, mainly because two of the speakers everybody knows. So the first speaker is Carmine Tiano, and he's the Director of Occupational Services with the Ontario Building Trades. The second one is Kathy Martin, and I just call her the mental health expert out of IHSA, and I think everybody knows her. And the third speaker, who's new, is Allison Lee, and she is a lawyer with Sherrard Coos. She's very smart. She has lots of experience, and when it comes to workplace investigations, going to the board, Human Rights Commission, she has a wealth of experience, but also kind of a wealth of knowledge, and is very passionate about this topic as well. And so. The panels that I host are generally fairly informal, but I think this one might even kind of push the boundaries. We're going to talk about mental health, but we're going to let people speak because these are some of the experts, and they'll help us get a feel for where we're at. Um, and so what I'll do is I'll kind of jump in with the first question. I'm going to look to Carmine first, but then, Allison and Kathy, please jump in as, we want to hear what everybody has to think. And so, we talked a little bit about it in the intro, Carmine, but we've been doing this for 7 years now. You've been on this panel multiple times. I don't know if it's seven, but it's certainly a lot.
Yeah.
And you're a leader in the labor world when it comes to this. And so we kind of wanted to give it to you to kick it off and say, okay, where are we at? Where's labor at? Where are you at? What are you seeing? And what do you want to talk about and highlight as important?
Yeah. Thanks, Andrew, and everybody for attending this. I think it's interesting that there's no doubt that since 2019, 2020, really, when the advent of COVID opened up people's eyes to non-traditional health issues. To me, mental health has always been there, but it actually opened it up. And then you had reports about substance use in construction. So I think let's take it from March of 2020 to 2025. I think we've done some good stuff.
Mm-hmm.
The very fact, but there's going to be a but in a second. The very fact that and Kathy's laughing, within the building trades and within the employer community, the idea of diversity, equity, inclusion efforts, contrary to what our friends in the United States are saying, are becoming part of a workplace culture. That is important when it comes to mental health. The other thing that I find interesting, and I actually call this modeling vulnerability. What it means that our leaders on the employer side, government, workers, are openly sharing mental health experience to bring down this big boogeyman of stigma. That's actually creating an open workplace culture. Ideally, what I find interesting is that all of a sudden, in the last 5 years, the idea of mental health, physical, combining with existing health and safety. That's all good. But now my issue is going to be, in many ways, what we've done in the last 5 years is picking the low-hanging fruit. Now, the question I go through my mind, where do we go from
Hmm.
here? That's the key. So where I think we need to go is we hear the words a multifaceted approach. But that's where it's going to be to go beyond the low-hanging fruit. So what I'm contemplating is employers and unions, when it comes to mental health and substance use, Andrew and everybody, I link them together. I
Hmm.
don't see one being separate from the other. And what I think we need to do on the employer and union side, we need to almost take, I know people are going to hate this word, a case management and workplace accommodation approach. A lot of practitioners do disability management, which I'm not crazy about the word, but I do believe in the concept. So that concept has two things: case management, which includes the appropriate medical regime, the
Hmm.
appropriate counseling, the appropriate, sometimes with a worker with a mental health issue. Hey, Carmen, you've come to Kathy as the employer. What we're going to do, we're going to remove you from work a bit. So we may get you into de novo. We may get you to a BPA program. And then rest assured, once we do the case management, we move into the accommodation. I want people to start talking about that. There are a lot
Hmm.
of people, Andrew, that just because they have a substance use problem, just because they're having mental health manifestations, necessarily you could be you can be in treatment and continue to be productive at work. So
Hmm.
this is where I want the discussion to go. Now, maybe I'll turn it over to Kathy and others on the panel, because I have some other ideas how we can get into this idea of a case management and an accommodation
Yeah.
approach.
Yeah, and just on that, I mean, you brought up stigma, you brought up modeling vulnerability,
Yeah.
but I think you really brought up, okay, we can talk about it now. There's no fear in talking about it. There
Yeah.
was 7 years ago, but how do we, I don't want to put words in it, how do we look at it with more holistically, right? And integrate it more. So I don't know,
Yes.
Kathy or Allison, if you want to jump in and share your thoughts based on that opening question of state of the industry, but whoever wants to jump in.
Well, I mean, I don't mind jumping in if that's all right.
Sure.
Again, thank you, ResCon, for inviting me. I'm always pleased to come and chat about this topic. Um, there's a couple of things that integration is key, and I think to what Carmine just said, and Andrew, we've been talking for some time now. We have some good tools out there to help facilitate that conversation if you're just starting on the road to talking. But talking doesn't get work done. It doesn't get solutions put in place. And so what we need to start looking at is you maybe heard this before, but what gets measured gets done. We need to start putting in some plans, and we need to do
Hmm.
some active measuring within our workplaces to see what's really going on in our workplace, because we can talk about it also too from the individual level, but then we can talk from the systems level and what's going on in my workplace. And there's at IHSA, we take sort of a three-pronged approach to tackling these issues. One is equipping our leadership in how to be vulnerable, to your point, how to talk about it, but also how to measure. What do I have to measure? How do I measure? So we equip them with that. We equip people to know how to support, how to tackle stigma, how to tackle their own personal biases, right? But what Carmine's talking about is our third pillar that we like to talk about at
Mhm.
IHSA is around that pathway to support and how do we support individuals within the workplace and when they go out of the workplace and then the reentry. So like it's this cycle, right? How do we get people supported throughout that continuum? And we don't talk enough, I think, about that. And the supports, as I think we heard from our ministers, it's disconnected. So we
Mhm.
need to have some very thoughtful conversations as individual employers with what's available in my community, what's available with my unions or the labor side of things, and how do I build my pathway of support for the workers that
Mhm.
are under me? Because that might look different in Timmins
Yeah.
than it will look in Toronto, right? So we need to build that pathway of support for our workers. And part of that pathway of support is understanding the return to work process and the accommodation
Mhm.
process, which is what Carmine was talking about.
Yeah.
Yeah, and before we go to Allison, it's tricky because you want everything standardized so that it's easy to access, everybody knows where to go. But we also know that the best support comes at the individual level, and it's
Absolutely.
hard to do both of those things. And so I want to turn it over to Allison to obviously kind of talk about the state of mental health, but you have a legal background. And so as part of your response, if you want to, what's going on at the board, what's going on at the Human Rights Commission, I think all the employers here are passionate and connected. But what are some of the legal issues that we're seeing with mental health, kind of in the here and now?
For sure. And I echo everyone else's thanks to RESCON for organizing this because it is a major and continuous issue and it's a major source of liability. Let's be honest, besides the human costs, it's also just a major source of liability for those who might not be converted just by the human cost. Okay, it's also money. We all saw that Globe and Mail report over the weekend, 20 billion in lost productivity over 4 years due to opioids alone. That's staggering in Canada. And of course, the majority of that, as we know, is in the construction industry. So, I think I echo the thoughts before me about early intervention, about, the longer a worker is out of the workplace, we know the harder it is to get them back, right? That's just sort of an ongoing issue. And so that ramp up and pathway Kathy was talking about, very important. But if I were really going to say, let's see, three trends I've sort of been seeing in the last year, I'd probably number them as follows. First, we are seeing that increasing talk very much from unions and employers. So good job, everyone. The number of videos I've seen about mental health interventions, we saw that iron workers video come out about harassment and bullying. There's a lot of awareness building, which is great. But that is just the first step, although it's certainly a step in the right direction. The second big trend, I would say, the legal one, is OSHA liability. Okay. So there's nothing earth-shattering that's come out sort of OSHA-wise in terms of, oh, mental health construction, here's your OSHA liability, it's increased. But we all know that OSHA, in terms of the liability for who's included, so Sudbury case, I don't think I need to say anything more than that, as well as the penalties, if you are potentially falling within that group, are increasing. Okay, so we know OSHA requires every employer to take every reasonable precaution under the circumstances for the protection of their workers. And now we know that as of December 2024, last year, and certainly now it's come into force, remember you've seen an increase in the minimum penalties if you fail to take those appropriate steps. And that can include things like, are your workers operating unsafely because there is
Mhm.
substance use? Are they operating unsafely in a way that causes a critical injury or, God forbid, a fatality, right? Because you might recall there's now that 500,000 minimum fine if an employer is found guilty of a second act under the OSHA that caused a death or critical injury within 2 years. So if you hit that second OSHA violation, you're looking at $500,000 in penalty, which is, some people have described it as crushing. It's a major amount of money. We're also seeing just increased penalties, I think, overall. Nothing to do with mental health, but you might have seen the Lemon Group construction penalty go through, $625,000 for a worker fatality against both the construction group and two supervisors. So OSHA liability. You got to know it, you got to keep it in mind, and particularly when you're thinking about these issues, keep your eye on it. But the swing side of that is that sometimes this makes employers really nervous, and you get construction groups, particularly, who are jumping the gun. And they are imposing on employee privacy and the dignity of their workers by jumping too fast to things like drug testing and things like moving people to, administrative tasks. And the courts are fighting back on that, and the boards are fighting back on that, and the arbitrators are. So, out of BC, we saw this year a couple $1,000 automatically awarded to a worker who'd been drug tested when it wasn't really necessary. He'd rolled his ankle on gravel, and the constructor was like, "Oh, we think he might have been on substances. We're going to make him drug test." And the arbitrator said, "Absolutely not. What are you doing?" And then you see out of Alberta, like 12,500 for a worker who has a significant mental health and substance use history. Okay. So this was an employee who'd had these demonstrated issues, but they require him to do, 2 full years of drug testing. And again, there's just this pushback. If there isn't a good reason for this type of testing, you cannot get to that point where you're just requiring all of your employees to drug test and to alcohol test because it's increasing the stigmatization.
Hmm.
Are your workers really going to go get help if you are drug testing everyone willy-nilly every time something arises, right? Are you moving them automatically out of their job instead of helping them? And so I would say those are probably the three trends I'm seeing, open, of course, to what Carmen and Kathy have to say.
Yeah, and maybe we can even jump to Carmen. Specifically, we heard about fit for duty and drug testing, and those are not new issues, right? And so I don't know what your thoughts are in that area.
Yeah, it's interesting on what Allison just said. I think one of the areas that, especially when you look at the numbers, and our first presenter from the ministry, from the prevention office, talked about it. One of the issues in construction is this idea of ongoing musculoskeletal pain. These workers have physical pain, not chronic pain as for the WSIB under their chronic pain policy. I'm just ongoing musculoskeletal pain. Then what's happened is you have workers that start to move into first their own medication, sorry, soft drugs, then alcohol, then opioids. So you are going to have this issue now, I think. Then there needs to be a discussion on fit for duty, and in certain situations when drug testing will be warranted. I think every time you bring up fit for duty and you bring up drug testing, people freak out. Certain people on the labor side, management, as Allison said, sometimes jumps the gun. But Andrew, I think considering the statistics, considering if we're going to take a multifaceted approach, considering if we want to put real programs in place to maybe move to a total worker health model of policies, and within that suite of policies, there will have to be a discussion on fit for duty, for sure. As Andrew, you're
Hmm.
well aware, you and I worked on one in 2019. I thought we had a good policy,
Hmm.
and unfortunately, it didn't go anywhere. And in that policy, if you recall, Andrew, there was drug testing way at the back under specific circumstances.
Yeah.
I think we need to start having that discussion because my concern is if there is another Kipling Avenue that's high profile, it will be forced upon us. I would rather disarm the torpedo before it hits our ships. So people are going to
Hmm.
go, well, Carmen, I'm not speaking for everybody, but I see it coming. I see it coming. And if we
Well, and I
don't,
think we've heard today that this conversation is evolving. And one thing that's jumped out at me is great for creating awareness, great for talking about
yeah,
it. But, this isn't 7 years ago. That's not good enough anymore, right?
no,
Like there's no congratulations now for having a conversation. I think
Exactly.
that's good. We're raising the standards. And so to your point, more and more of this stuff is coming. And like I have a labor relations background as well as the health and safety. It is always better for labor and management to get together and figure out what we want to do instead of somebody else bringing it to us or pushing us into it.
Yeah.
Construction is just too unique to do it any other
Yeah.
way. But again, I'll open it up to Kathy or Allison on fit for duty and some of the stuff that Carmine just said. Whoever wants to jump in.
Well, I'll jump in.
Mhm.
I always like to piggyback on what Carmen says.
Yeah. Thank
Um,
you.
yeah, no, I think this is something we're hearing at IHSA. I'm certainly hearing it as a mental health and wellness specialist here. I was at a great conference that we put on in London. We did a health and safety day down in London. I think it was in the spring. And we were talking about Fit for Duty. We were talking about drug testing specifically. We had a lawyer come in and speak to our labor management folks down in the London, Southern Ontario region. And I heard very loud and clear from everyone in the audience, labor management included, they all wanted to learn more. They all wanted to know under what
I'm hearing that.
circumstances
Yeah.
can I do this? Can I not do it? They were very worried about stepping on toes and wanting to do it right. Like they want to do it right.
Mhm.
They want to be mindful about it. So, I took that on and said, okay, well, we'll try to help fill that gap over time. Obviously, I just say we have limited resources and time, but that is something on my radar is to start equipping the industry with that conversation and tools to have that conversation. So, Carmine will be getting probably a phone call from me and Andrew and others
Mhm. And
as we
it's
move
more
forward.
not to do it in a punitive way
Yes.
No, 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 no,
but
not
in
at all.
a, to use Carmen's like a total health
Yeah.
approach.
Absolutely.
Um,
It's a
yeah.
reality. I mean, let's be honest, it's a reality. Not everyone is well enough to be working, and we need to be able to find out in a concrete way um, who's not fit
Mhm.
at one particular moment. And it's sometimes nuanced. And I'm not the lawyer in the room, so I'll pass it over to
Yeah, and
Alice.
maybe we'll go back to Allison for kind of the final thoughts on this point. So,
It's a tough one, right? And I think the point and the theme I think I heard all three of you echo is not that you can't drug test. It's that you need to have a plan before it becomes an
You got it.
issue so that you're not doing it willy-nilly. And
Mhm.
if you are doing a fit for duty framework, great. I think that's a fantastic idea. And it may include something like drug testing. We're talking about the whole, wellness
Yeah.
of the worker. But what you want to be avoiding is sort of that we haven't thought it through. It's a knee-jerk reaction. We're going to send you for drug testing. And then you call me at some point in time and I say, okay, so why? And what's your policy? And how'd you get there? So the
Exactly.
earlier you can think about these things, the more likely you are to comply with your OSHA requirements and avoid the flip side of having done sort of that knee-jerk problematic reaction.
yeah, and I think that makes a lot of sense, and we're gonna pivot a little bit here, and I'm gonna look at you, Kathy. So we've heard kind of from Carmine some of the successes, some of the things we're looking at total health. We've heard from Allison, this is the legal background, and if you're not taking it seriously, these are the liability and the risk you're taking on. And so now we're looking at you, Kathy, and saying, okay, you do great work. The IHSA does great work. Talk to us about some of the resources that are out there and some of the resources that you want to promote. So I'll turn that over to you.
Oh, well, thank you. Um, so there's lots happening at IHSA. We've spent the better part of the past 5 years developing tools and resources. So our website has the mental health uh, presence when you come to our, just for those who are maybe listening who aren't too familiar, ihsa.ca. And then if you go to the homepage, you'll see up in the left-hand corner a box that has a little brain. It's a little red box. That's our platform. You just go in there and there's lots of different tools and resources. But I think, we've equipped, like I said, lots of safety talks there for folks to participate in and tools that I've talked about in the past. But what we're really pushing now is skill building. So like there's having the conversation and raising awareness, and then what? And then I think we still are at that early stages of equipping folks in the industry to have the skills, to have the conversations to understand what these issues are. even things like what is fit for duty? What are my rights like under the internal responsibility system? What are my rights as a worker? What are my rights and responsibilities, right, as both workers and employers? So we have some new training. We have opening the door for support, which is a free training, and everybody likes the word free. And it is really meant for anyone who is a people leader. And that doesn't mean, you have to be a manager or supervisor, have the title. But if you're involved with managing people in any kind of capacity, this is the training you want to be able to take. And it will help equip you to have deeper conversations around some really challenging issues. And we didn't skirt the issues. We came out hitting hard. We hit out hard. We talk about suicide. We talk about substance use, opioid use. We really go into some of the deeper conversations that people are wanting to know more about. From now until the end of December and likely what I hear, maybe into the new year, we have some free training right now. All of our online training is free and available. When I say online, I should say on-demand training. Better get that right. All of our on-demand training is free. So we do have a program called, oh, I'm just trying to remember the name here, but it's our occupational health course. Now, if you're a leader and you maybe heard me talk about earlier, but gets measured, gets done. Well, if you're not sure what you need to measure or really understand this whole concept of psychological health and safety, what does this mean? If you're still trying to grasp that, that's what that program will help unpack. It's only 20 minutes. It's quick little intro to that concept. What else? We've got consulting. I think this is a big thing. Again, pushing people to stop talking and start doing and put in your plan, look at the different pillars that we have that we promote, start building out your plan. And if you need support, come to us. We're doing active consulting right now with employers. We'll sit down, we'll help you get a plan together on where to start. So those are just a couple things, I guess,
Hmm.
to
No, I think
get you
that's
going.
great. And I do like this evolution of, talking's great, but you got to do more than that. And
You got to start
so,
doing, yeah, yeah.
yeah, so I don't know, Carmen, Allison, any resources you want to highlight quickly? Otherwise, we're gonna move into kind of the closing remarks. But we do have time though. But I know there's lots of great resources out there, but I don't know if anyone wants to highlight another resource or two. So,
I'm just going to shout out DeNovo, who's coming up later. I was talking to a bunch of my colleagues, and that was the name on everyone's lips. So, you'll see them later. Take advantage of them. They've done a lot of very good work.
Absolutely.
I know I don't know if you want to talk about it, Carmen, but kind of the suicide prevention, and I know the building trades have gotten behind it, and some of the hotlines and numbers they can call. But
Yeah, I mean, I don't have them off the top of my head, but most of the unions have the specific information you can get. The province of Ontario has the hotlines, the feds, public health, public health, the municipal public health have hotlines. But
hmm
again, one thing I say, and Kathy's heard me say this at meetings. I've suggested to our unions, if you're going to provide a service, make sure you vet that service. That if you're going to give Carmen that number, you got to make sure that someone's at the end of that phone to pick up when Carmen calls. So
hmm
the key that I've been advising a lot of our trades is you want to, sure, everybody wants the Bugatti mental health package, but it's okay if you're going to provide the Toyota RAV4, but make sure that it's working fine. Okay.
hmm
That's my biggest thing. Quality assure it, quality assure it, quality assure it. Because if it doesn't,
just as far as hotlines, though, I
yeah,
agree. Someone's
yeah,
got to answer when somebody calls.
yeah,
988 is
yeah,
is one that we know at a CAMH,
yeah,
and there's other
yeah,
ones, and we'll get those out there. But that
yeah,
is that is a great
yeah.
example. So. I wanted to leave a bunch of time for kind of the last segment. My favorite way to end a panel is to ask each speaker for kind of their final thought or one thing they want the audience to walk away with. So I've left about 8, 9 minutes for this. So you do have a bit of time, but I'm going to look at all the speakers. I'm going to say, okay, what's one thing you want to leave the audience with today? And so I'll go kind of the same order. I'm going to start with you, Carmen.
Yeah, one thing I like to, for everybody that's listening, is that I like to see a paradigm shift when it comes to health and safety to start taking this total worker health model. The Boilermakers in Canada are doing it. All their programs have a total worker health perspective. That model came out of NIOSH 25 years ago. I think a lot of great work. Integrate your physical well-being and your mental health well-being into your programs. Look at your accommodation. Uh, Unions, it still boggles my mind that very few unions have any collective agreement language on basic accommodation, disability management. So I think if you could have a total worker health perspective on mental health, you'd be able to amalgamate the good work that's being done and just start targeting it a little bit better.
Hmm. I think that's fantastic. And we'll go to Allison next.
So I represent employers and employers only. And from that perspective, I would say to every employer, every construction group out there, that if you find yourself a little bit in the, we've made the policy, we've made the support, but we're not getting the buy-in to actually make change, cost it out. One of the probably most significant things you can face is legal liability. And there is significant amounts of legal liability at stake if you ignore clear signs of mental health or substance use disorder amongst your workers, not just sort of the health and safety, but also the human rights side of it. And that's not where you want to be. And so, if for no other reason, it is a significant cost and burden. And think about your lost productivity, even. If you're not going to intervene early, you are losing so many man hours due to not just the worker themselves and their absenteeism, but also the management of that. And so, if you want to reduce all those costs, if for no other reason, then yes, I would say you need to be looking at making actual possible change into your workforce to make sure these things are addressed early.
Oh, that is very good advice. And Kathy, you get the final thoughts.
Lucky me. Well,
Hmm.
I don't know. You said we had some time, Andrew, so I'm not sure. Is it any possibility that I could share two slides? Am I able to share screen?
Absolutely. You
Yeah.
should be. You should have
Okay. Well,
accept
let me
or
just
set that
see
up.
here. Let me just see here. Yeah. Okay. You see a slide here?
We can.
Okay. I won't pull up the whole slide, but I just wanted to share two slides. The Institute of Work and Health helped pull together some stats. So there's an industry, a joint industry labor group that's come together to look at suicide and suicide prevention within the construction industry. And we asked them to pull together some data for us that was Ontario specific. So I just wanted to show you what they came up with. And it kind of goes to what some of the ministers were talking about earlier is we see our from 2016 to 2023 is what the time frame was. In that time frame in Ontario, we had 170 traumatic workplace fatalities. The number of suicides that we had in construction were over 500, 565. And then when you added our drug poisonings, which was 795, so I think the minister said 750, like so around that, we were pretty close in our figures. They came up with 795 plus the 565 gives us the 1360. So just wanted to show this graph how we have like the stepped approach. So if there's anyone
Mhm.
out there not thinking that we have an issue, sometimes seeing it in graphic form helps kind of like drive it home. And so this is what we're talking just from a death perspective, the lives lost. And of course, 170 is way too many, but when you look keep going a little to the right, we're really
Mhm.
getting quite high. Now the next slide, sorry, I'll just my cursor here giving me troubles. Always giving me troubles, my cursor. Now we also asked them to put critical workplace incidents again in the same time frame we saw just under the 3,000 mark,
Mhm.
2,704. Self-harm, now self-harm, for those who are wondering, self-harm is attempts on taking their life, so suicide attempts that were through the hospital system. And I could tell you, I would need Peter Smith and Dr. Nancy Cardnight here to kind of give you the nuances around the study, but We saw 3,000 attempts of people taking their lives through suicide. And then if you add that with drug poisonings that did not result in death, so we're talking about toxic poisonings or overdoses, we were at over the 6,000 mark. And then you put those who are known to have a substance use disorder, we're well over the 20,000 mark. So just again, showing that stepped
Hmm.
increase that we have a significant thing to start chipping away. If we want to bring our numbers down comparable to our physical health, right, or physical injuries and our physical deaths, and even reduce both of them, we need to do some work. So that's just where I wanted to leave it off with some
Yeah.
new statistics. Let's get on board. Let's all work together because it's going to take a village to, it's cliche, but it takes a village, and we are going to have to really start to put in some concrete pathways to support for our workers and equip our workplaces and our
Hmm.
people that are educating, obviously what they're educating about, but those who are employers, again, not just the risks, but how to plan, how to actually do something about it. Right?
Yeah,
It's not something that they really intuitively know what to do, right?
I think these charts are they're unfortunate, but they're a great way to kind of end this panel and
Yeah.
start to transition to the next panel because yeah, I mean every injury, we'd like to prevent and every death we want to prevent. But when you start looking at the numbers, it's staggering. And I don't like people are talking about it, but I don't, until you see the number 20,000 on there, right?
Mm-hmm.
Um,
Mm-hmm.
like that's significant. I think that number hopefully will stick with everybody. But thank you to all the speakers and for all the good work you do. And yeah, I just thank you for the time and the commitment on this very tough issue. So
Thank you.
with that, we're going to bring on Meredith, who is going to moderate the next panel. And that panel is titled, What Does Help Look Like? And so, like everybody listening to this, we have a problem. There's no debate there. And now we need to, what are we going to do about it? And so we'll turn it over to Meredith. We'll introduce the next panel.
Perfect. Thank you, everybody, for that wonderful panel discussion. So next, as Andrew just mentioned, we're going to be looking more at what help looks like. And in particular, I think this panel discussion will be kind of like a mini presentation from each organization, just to be able to highlight all of the good work they do. So we're lucky to have some great speakers here with us today. So we have Sandra from BPA Financial Group, we have Sarah from DeNovo, and we have Corin from MedCore. They're all great leaders in the mental health and addiction space. So I will pass it over to each of you to introduce yourself. So maybe we will start with Sandra.
Hi there. So I'm Sandra Correa. I'm the Director of Health Management Services here at BPA. A little bit about what we do at BPA. We help organizations manage their employee benefit plans. And a big part of what we do is help support the health and well-being of the people behind those plans. That includes helping members navigate mental health services, addiction support, and other resources that can make a real difference. In my role, particularly, I work with our team to ensure that our members and their families get connected to the right type of support. We all know that mental health and addiction is really challenging in the construction industry, and conversations like these help us better understand and find solutions. So yeah, thank you for having me.
Perfect. Thank you. We will let Sarah introduce herself.
Great. Thanks, Meredith. My name is Sarah Beaudoin, and I'm the Coordinator of Program and Staff Development at DeNovo Treatment Center, which is just a fancy way of saying that I take the lead on a lot of our quality improvement initiatives. So I'm always looking to inform myself of updates that are happening and in the broader community, being whether it be government policies that affect mental health and addictions, or just new and emerging best practices as it relates to mental health and addictions, just ensuring that the different programs that we offer, the content and the services that we provide is still proven to be helpful and relevant. A lot of what I do as well is working with CACCF, the Canadian Addictions Counselor Federation, which is our accrediting body as well. So we're just overseen from that respect as well. But yeah, I also work very closely with our clinical team, and I'm an advisor to the leadership team around like how do we keep this place a place that's actually going to affect some meaningful change for the people who come to receive treatment here. De novo is a unique environment. So, for anybody who may have no idea what de novo is, I'll just start at the beginning. We service only people who are employers, members, or families related to people within the unionized construction industry. Specifically, there are certain locals that contribute to de novo treatment center. We have a list of over 100 unions that contribute to the effort here to get members the help that they need. We are a 35-day in-house residential addiction treatment center. And there's a lot to know about that, but I'm sure more questions will come. But I'm really excited to be here and invested both professionally and personally in the topic here today.
Thank you very much for joining us today. And last, we will let Corin introduce herself.
Hi, everybody. Thank you so much for having me here. My name is Corin Waynes. I manage the Mental Health and Wellbeing Department for Medcore Canada. Our main line of business provides occupational health medical services to clients all across Canada. And I was the lucky one who got brought on to start addressing the mental health. So I'll share more about that in a little bit, but really happy to be here and be a part of the conversation.
Perfect. Thank you very much for joining us. So I think we'll jump right into the questions. So we'll start with Sandra. So BPA offers a wide range of services to the construction industry. Which mental health supports are most commonly used and have proven to be the most effective? And in addition to the mental health services, what other type of assistance does BPA provide?
Well, given that each member's situation is different, it's hard to highlight just a single support as being the most used or most effective. We focus on offering a wide range of services so that we can tailor treatment to each person's needs. We provide several mental health and addiction supports to ensure that the members and their families get the right help. So our services include the MFAP, so the Member and Family Assistance Program offers confidential support for mental health concerns, stress, family issues, day-to-day challenges. We also give members access to virtual and personal therapy, making it easier to connect with licensed professionals. For addiction-related needs, we offer several treatment options, which include a substance use management and recovery program, specialized opioid outpatient services, and intensive outpatient programs for both mental health and addiction. For members who then require a higher level of support, we do offer inpatient addiction treatment, followed by aftercare programs to help maintain long-term recovery and prevention relapse. We also provide psychological trauma recovery services and critical incident services, ensuring that members facing severe or any unexpected health events have access to these resources right away. In addition to the mental health services through plans like LiUNA Local 183, BPA provides a wide range of benefits that support our members' overall well-being. We offer expedited healthcare services. So we expedite specialist appointments, several diagnostics, which include MRIs, and some orthopedic and general surgeries as well. So we can have those expedited for our members. We also provide healthcare navigation and cancer assist services. Those offer members and their families confidential access to nurses who can assist them in navigating the healthcare system, which can be challenging at times. So those are some of the plans and some of the treatments that we offer.
No, that is very great. And I know, especially in our industry, there's a lot of people that English is not their first language. So navigating the healthcare industry can really be difficult. So that's definitely good to hear that that service is available to them. Moving forward, I think we'll look at Sarah next. So, Sarah, De Novo Treatment Center is a leading treatment and recovery center for the construction industry. What mental health and addiction services have proven to be effective, and what other services does De Novo provide?
Yeah. Well, I'll start by just letting everybody know that De Novo is based on an abstinence-based model of treatment. So what that means is our core program, our residential program, is primarily based on what's called the Minnesota model, which really incorporates a lot of the 12-step community terminology and beliefs that abstinence from substances is the most reliable means of the beginning of recovery. It's kind of the foundation on which we believe that long-term health and wellness can be sort of started and attained and tapped into. Although with that being said, we do support people individually who are more interested in harm reduction, but we do always try and encourage people to consider what it might be like to just take a step back from substances in their entirety, particularly in the first year of recovery. But what we know about residential addiction treatment center is that the most effective way to help people is looking to highly effective evidence-based tools. And so our clinical team is trained and receives refreshers on modalities like motivational interviewing, cognitive behavioral techniques, and we also like to think about that strength-based approach. So understanding that people who are coming to treatment are already coming with the various strengths and things that they have internally that they've either lost touch with, or that they can utilize to support themselves in their recovery. So yeah, we just kind of look to say, like, what does the evidence say? Earlier, I mentioned that we received the skills development funding for the last couple of years, and we've begun doing more in-depth research for people in the trade specifically and what people with lived experience is saying. And we've incorporated a lot of that into our programming as well. So, I have to give a shout out to IHSA and all the really great material that they've made available. I went to Local 50 maybe a year or two ago, and Carmine presented a toolbox talk there, and we were able to take that back and look at the IHSA website and develop an optional programming for people here based on toolbox talks material that was offered through IHSA website. And so, like, really, really looking at what are the best practices in addiction as a whole, but also how can we make that more specialized to the construction sector in particular. Addiction week, awareness week just kind of passed us recently. And I've heard a lot of leaders in the trades and kind of talk about how the fact that it's good that this is a week-long thing because, addiction is a chronic lifelong challenge and mental health as well. And so recently our research team, every day that this past week, last week, provided optional seminars for clients in-house around what the data has shown for them, and what their brothers and sisters in the workforce have been saying about their experience. So yeah, we have that residential, which is our core program, but we also have the family program. A lot of really new and exciting enhancements are happening for the family program as well. Right now, traditionally, we're looking at that. We have our content has been geared towards that nuclear family, but now we're looking at broadening that experience because what people are saying, I have family of choice, or I have friends, support moves beyond the family. And so we're really looking at making a more robust support person family program in the future. And as far as continuum of care and aftercare, whatever terminology you use in your world, what it looks like to support people when they leave treatment is obviously huge. And we do have various aftercare options, both that we as De Novo facilitate, but also like resource connecting are things that we do as well. And that would be really just individualized based on what people say they need and what they want, what their goals are. So yeah, I could talk all day about this kind of stuff, but I will kind of close it there.
Sounds good. No, this topic is very important, and I know a week of awareness isn't even enough, so I'm sure we could all talk all day about this. I do just want to touch upon, I think it's so great that you've worked with both Carmine and Kathy before. I think it shows how important it is for the resources to all come together. It helps everybody formulate better policies and create better strategies to navigate this moving forward. With that, I think we will move to Corin. So MedCore is known as a leader in providing employers with accessible services for their employees. What sets MedCore's employee mental health programs apart from other service providers? And beyond mental health support, what additional services and resources does MedCore offer?
Thank you very much for that introduction. We have developed our virtual mental health support to be simple. We really wanted to take a look at the existing supports that were available right after COVID and do something different and make sure that things were easily accessible for our clients. We initially created this service to support our own advocates, that's what we call our employees here at MedCore Canada, in 2020, and we quickly saw that there was a real need for this type of service. So we began to offer virtual one-on-one sessions to our own employees, their significant others, and adult children over the age of 18 across Canada. What we provided them with was a safe place to share their everyday stresses, to discuss the challenges that they face in having crucial conversations with people in their workplace or their personal lives. We teach them how to learn how to set healthy boundaries and share the importance of incorporating self-care so that they don't burn out and have nothing left to give to those around them. So we started offering education around different mental health struggles through webinars and lunch and learns. And we also took this proactive approach to talk to somebody about those struggles. We saw right away that utilization took off, and we realized that we were onto something and that not everyone needs an evaluation and diagnosis for or treatment for mental illness. They really do need somebody to talk to. Everybody needs somebody to talk to who listens to what they are comfortable in sharing at that time and to walk through those ups and downs that life throws at us. So what we did was we rolled this out to our parent company in the US, and we saw it really take off there as well. I found that I was the one at the time doing the sessions, and that people knew deep down that they needed to talk to somebody, but they didn't really know the ins and outs of their EAP or their benefit package. And other than kind of a 1-800 number on a poster, they didn't even know what those supports would even look like if they did reach out. So we also heard that some people had had maybe a negative experience in the past, and they were reluctant even to reach out to me to talk at first. So I learned a lot in that first starting stage of developing this service, and realized the importance of building trust and relationship with clients in hopes to have them want to return for more support, and to learn these strategies and use the resources that would help them to manage stress and navigate life in a healthy way. So this is where our mental health support service is different. We try our very best to get in front of each and every new client that partners with us. So when a new company comes on and signs on for this service, we do several introductory meetings that they can record and disseminate to their workforce. We promote the mental health team. The clients get to know the people that they would actually be having the sessions with, and we share how easy it is to access the supports if and when they might want to. It's never ever mandatory for them to use the service, but it's mandatory that they know where to find it if they want to connect in the future. So with this service, employees have no limit to the number of confidential sessions they can access. They can meet with the same advocate for follow-up sessions, so they're not retelling their story every time they meet. And this service will never cost the employees a thing. It really is an added benefit to them for working with a company that partners with us. And it's our hope that individuals reach out early when they are seeing that they might not be coping as well as they should, and before things become a real issue or concern for them. This is our proactive approach. And we really do want to keep the service simple, and we view this service as a first line of defense when it comes to mental health. So if someone requires a higher level of support, we love companies that have EAPs as well, because we want to be armed with the information and the resources for those EAPs to help get those clients connected and maybe bridge the gap while they wait for those supports to become available. We get asked all the time if they can still talk to us, and the answer will always be yes. We will continue to be there to support the everyday things that come up for them, while those higher level of supports address the things that are beyond our scope. So we also, I think what stands, makes us stand out as well is that we provide reporting to our clients when enough data is available through sessions to really help us to create group sessions or those webinars and lunch and learns on topics that we see recurring in those one-on-one sessions. And those are also done virtually, recorded and disseminated for the workforce to watch at their leisure. And we really do want to partner with companies to help educate their employees on mental health topics so that they have the skills and the tools to address them in a positive, confident way. So what we found was we took this to market. We thought this can't just be our people who maybe would benefit from this. So we made it a really affordable option. And now we have clients in various industries across Canada and the US. And our partnership is longstanding with the OGCA in Ontario, and it has really allowed us to expand our mental health clients to have become a mostly construction-facing clientele at this point in time. As has been discussed today, the construction industry faces unique challenges, and we have quickly become the service provider that our clients rely on to help their people proactively address key topics that cause stress for those working in the construction industry. We hear about it all the time. We understand the pressures and the deadlines, time away from family, long commutes sometimes, and the toll that such demanding work physically can have on one's mental state. So I know Carmine was earlier talking about MSIs and living with chronic pain and how that can negatively affect the mental health of that worker. So we're working really hard to normalize talk of mental health in the workplace, one client at a time, trying to make it comfortable for employees to reach out to talk if they're struggling with any of these type of challenges. And then you did ask about what else we do at Medcore Canada. So virtual mental health is not all we do at Medcore Canada. As I said, we just rolled this out 5 years ago, but this year marks our 20th year in the occupational health industry. So our core business is providing medical services on site at our clients' work locations, whether urban or remote, anywhere in Canada. And we really do help our clients reduce claim costs and create a healthier workforce. So we have medical providers in remote locations across Canada in clinical settings and mobile treatment centers. And we get to care for the overall health, that holistic approach to the clients that we serve. And some of those locations have also partnered with our virtual mental health supports. So we really, I pride us on having a circle of care approach for all the workers on those projects. Boots on the ground medics or nurses who can really point employees in the direction of our virtual mental health supports to address all the things that I have highlighted here. So we've also recently announced our partnership with Opening Minds through the Mental Health Commission of Canada, and are able to help our clients connect them to Opening Minds for training and facilitation of different courses like mental health first aid and psychological health and safety. So we are really proud of the work that we get to do and the impact that we get to have on our clients and getting employees healthy and keeping them that way, both physically and mentally. So that's kind of a high level overview of what we're doing here.
Perfect. I appreciate that it's very difficult for you all to pack into 5 minutes all the great work you all do. I do want to touch upon how great it is that you guys offer that virtual service, especially for construction workers that we know are working long hours and it's a physically demanding job, that it is great to know that they have access to something like that they can do from home, maybe in hours that aren't necessarily the normal 9 to 5.
Exactly. Or from their truck on the work site because they've got 20 minutes on a lunch break and they need to talk.
For sure.
It's awesome. Yeah.
No, that is great. I do want to ask another question and open up the floor to all of you to offer your insight. So from your experience, what are the barriers preventing those in the industry from seeking treatment? How can employers provide effective support for those looking to take the first step?
So for what I see here, mainly most of them aren't aware of what kind of benefits are available to them. So that is one of the barriers. A lot of them don't know what type of benefit plan they have and what's available. They don't realize that they have access to confidential mental health services. Some of them may be newcomers to Canada and don't speak English. So it's hard for them to know and understand what they have. Sometimes I see that they're they're afraid. They're afraid how asking for help is going to impact their job. What's it going to look like? They're worried that if they're admitting that they're struggling, that they may not have a job to go back to, once they want to go back. They're afraid how they're going to be perceived on the job site. So we see a lot of that. Also, obviously, some of them, it's also that culture of toughness, right? They feel like they're expected to push through. They're expected to ignore their emotional struggles, and they're just afraid of being seen as weak. And as a result, they don't ask for help. That is what we see a lot coming through here. How can employers help? Maybe also knowing what benefits are available, what support is available to them, making it visible, making it easy to access on the job site so workers know that they are able to seek help and, it's safe, it's expected. That's kind of what we see here.
And I know just from past conversations that I've had, it does seem that the family members of the workers seem to access the services, whereas the worker themselves don't. So I think
You're right. A lot of time we're getting calls from family members saying, either my husband, my brother, my dad needs help. Like, can somebody help them? And what we do here is we actually we reach out. We reach out and just touch base and talk to them and explain what's available and offer the support.
Perfect. And then now we will move over to Sarah.
Yeah, I definitely echo Sandra's sentiment that what we experience here at De Novo is the people that we're trying to support really have no idea how to navigate their benefits or their EAP plans. And I think oftentimes, they've talked about how the fact that it feels like a hurdle and they just don't know what's available to them. But, before, above and beyond even like that knowledge gap and the stigma, which is, I think, something that, like the culture at large in trades is moving in the right direction. I think it's like a time and energy piece for me that is the barrier. Like creating a truly recovery friendly workplace, creating a truly recovery friendly home environment. This requires constant like vigilance, time, and energy from everybody that's involved. Change is hard, and so it's like a long-term investment, right? And so really just the time and energy it takes for employers and family members and the person seeking recovery to just stick with it, even when it's challenging, I think is a big barrier. And what I can say around how employers can help specifically as it relates to De Novo anyway, we've recently published a handbook, a De Novo handbook on our website, denovo.ca. It's the handbook for contributing unions and employers. And so the first couple modules really speaks to like, what does it look like to get the ball rolling to get someone into treatment? But then it also moves into like, what is a 12-step program? And towards the end there, it has some crisis navigation module that talks about preventative in the moment and ongoing support. And in every module, there's something called next steps for the readers that really talks about what are some actual actionable things that I can do to kind of help support, right? And even looking at that last module, like navigating crisis, there are a couple, like, I don't want to call them buzzwords, but like, there are a couple topics that employers can look at to get them thinking about what even should I be thinking about? Because at the end of the day, resources are great. But sometimes I find too another barrier is like resource burnout. There's like a long list of laundry numbers. There's all these different people and all these different touch points, and people are just like, whoa, that's overwhelming for me. I'm just trying to get back on my feet. I'm still feeling crummy. I'm still having using dreams. You know what I mean? Like, so at the end of the day, like the biggest facilitator to moving towards wellness is just people learning how to be human. And I've talked about this concept, like we think about people on the job site, we talk about the policymakers all the time, and that's great. Yes, we need to that needs to change. We talk about getting out of silos. Yes, we need to get out of silos. But then you're forgetting about this whole other demographic of worker who like doesn't have an addiction and is not an employer and they're still on the job site, right? And we can't forget about these people too. So I think just, yeah, looking at where as an employer I can learn more about how I can make it a more recovery friendly workplace. What can I do to contribute to that? There's no shortage of information and tools and people to talk to out there about that.
No, I think that is a very, very valuable thing that you just said. It is a 24/7 commitment for people to try and navigate the struggle that they're going through, and they need that help from their employer. We all spend so many hours a week at work, so you really do need the support there as well. So thank you very much for touching on that.
Yeah,
And
and I just want to let people know too, like people can call De Novo just to chat as well. If an employer is curious, we also try, it sounds like BPA and MedCore also try and make themselves available just for a call and a question, just to be human.
perfect. And we would love to share resources from all of you as well in our post-event summary. So please send that over. I know you just mentioned the De Novo handbook, and just showing everyone what is available would be great. And then lastly, we have about 3 minutes left, so I want to give Corin the floor to end this off for us.
Yeah, I appreciate it. I ditto everything that has been said here. In my own personal experience in finding mental health providers for my own family in the past, as well as what I hear about from clients and their experiences, the barriers we hear about are long wait times to meet with a provider. That will prevent people from reaching out. I don't need to talk to somebody 4 weeks from now. I need to talk to somebody fairly immediately in some cases. Not being able to meet with the same provider for follow-up sessions can be a big thing. They don't want to show up and have to retell their story and start over every time. And a big one for a lot of people is that limited number of sessions that they're allowed to use before they get cut off from the service. So again, people don't know enough about what the supports entail. I've actually had sessions where I share with people, you know what, you have access to an EAP. Do you realize that you have somebody that you could get some free legal advice from or some financial support? We're not going to be the subject matter experts in all of those. So thank goodness you've got this EAP. Let me help direct you. They'll come back 2 months or 2 weeks later and be like, thank you so much. I had no idea. I also hear from the clients of people who are reaching out to us to say, hey, what does your service look like? What their feedback is on some of their EAPs is that it's more of a reactionary type of thing. That people are reaching out when things are really not good, when they're not managing well, and that they're not connecting to a provider when they're just starting to not feel like themselves and aren't sure really what the signs are to watch for. And so I think sharing some awareness with that as well with the leadership and of the company is what are the signs to watch for in our people. Good leaders have a pulse on their people, and we check in and we, how are you doing? It's not that person's job to be the subject matter expert and provide strategies and resources. But if you find out that somebody's not doing very well, or they're not sleeping well, or they used to have lunch with everybody and now they're, kind of keeping to themselves, we're seeing different signs. How do you direct them to the supports that are available? So I've also heard in the 5 years of doing this as well that many of our clients will reach out and chat with somebody on my team. And because this is such an informal, non-clinical type of setting, it makes people very easy to feel at ease to really open up and share about the things that they're going through. And we've even heard that, they get more out of 1 or 2 sessions with somebody on my team, more than they did in a year of talking with a clinical therapist. Because the truth is they didn't need any evaluation and treatment for mental illness. They just wanted to know how to deal with the demands at work and the fact that they're showing up late every night and their wife is ticked off at them. So just learning about, how to shift our mindset and having those tools and strategies really can help them when they're facing these different circumstances. So, yeah, I think that's pretty much the only additions I had to what was already shared.
Perfect. Well, I just want to thank you all so much for joining us today. I think I can say with confidence that this was needed, and echoing what everyone said, it does seem like people don't know what's available to them. So I do think this panel discussion is a great first step for our members to see what's available and how they can better support their employees. So I just want to thank you all again, and hopefully we'll see you all again next year.
So this perfectly brings us into our next panel or presentation. So we've already heard the important insights about the state of mental health in construction, as well as the resources available to support workers across the industry. So that kind of connects us into both of these and builds on those discussions. So I'm pleased to welcome Mark Nolan and Irina Ten from Multiplex. Multiplex is an organization that's being recognized for its proactive and innovative approach to navigating mental health and addictions within the construction sector. So I'm going to just pass it off to Mark and Irina, and they're going to share how Multiplex is addressing these challenges in their workforce and then the broader industry. So welcome, Irina and Mark. Thank you for being here today.
Thank you.
Thanks, Yasmin. Good afternoon, everyone. As Yasmin mentioned, my name is Mark Nolan. I'm the Director for Safety, Health, Environment and Quality at Multiplex Construction Canada, and joined by Irina Ten, our Senior Manager for Human Resources. Again, very happy to be here. I'd like to thank Andrew and the RESCON team for inviting us. We're privileged to be here. Sorry, just double checking. Is somebody sharing the presentation?
Yes, I'm going to share your presentation for you.
Perfect. Thank you. Great. If you could move on maybe 2 slides. I'll go one more. Perfect. Thank you. At Multiplex, everything we do starts with our purpose, which is building or constructing a better future. For us, it's not just about the buildings, it's about the people. We do care deeply about our teams and the communities we're a part of, and that mindset shapes how we work every day. Move on. Next slide. As an industry, we know we excel at problem solving. We fix hazards. We talk about equipment failures. We act on workplace incidents, and we build the unbuildable. Our systems for physical safety are strong, some of the best in the world. But as was already mentioned today, where we need to be honest with ourselves is while our physical safety systems are sophisticated, our systems for mental health and the psychosocial risk have not evolved at that same pace. Next slide. In addition, we talk about controls. Again, I think Carmen was leading into this earlier for physical hazards. We'd never rely on a poster or an awareness campaign alone. We engineer solutions, we verify, and we hold leaders accountable. Yet historically, that's exactly what we've done for the mental health awareness without action. It's time to change that. We know we need to treat the psychological hazards with the same rigor as the physical ones, integrating planning and verification into that work. That means embedding the mental health into the risk assessments that we're doing on a daily basis, designing work to reduce the psychosocial stressors, training supervisors to intervene early, and measuring outcomes, just like we do for the critical tasks. Because if we wouldn't accept the crane collapse after hanging a poster, we shouldn't accept a suicide after a toolbox talk. Next slide. A number of panelists and people on this call are part of this group, including RESCON, but Multiplex. We are proud to be part of the Ontario Construction Industry Suicide Prevention Roundtable, which was formed back in 2024, I believe. This group came together because we wanted to make a difference and to push for transparent data from our industry, none of which was available in Canada. We're working alongside partners, like I said, like RESCON, and their leadership has been instrumental in driving this forward. Next slide. Kathy's already shared these, but it's a good thing because we need to be sharing all the great work that the IWH has been doing, for us as an industry in Ontario. So that's why I want to thank them and thank Kathy for pushing this out to as many people as we can. The simple fact is we're losing far too many workers to suicide and drug poisoning than traumatic incidents. This is the biggest killer in our industry, and many people don't even know it. I was on a call earlier with the Ministry of Labour, where they released their stats and their data. So as of the end of September, for the year 2025, unfortunately, we've had, and Ontario's seen 8 traumatic fatalities. If we look at these data points that we've got in front of us, estimates suggest that up to 64 people this year have already lost their lives due to suicide and drug poisoning. That's not a gap. That's a crisis hiding in plain sight. Can you move to the next slide, please? And again, another slide Kathy shared about hospital encounters. The risk is 7 times greater. If these were accidents on sites, our industry would shut down tomorrow. But because they're the psychological injuries, they just remain largely invisible. I again will share all of these slides at a later stage. If we can move to the next slide. This is an interesting socio-demographic based on the work from IWH. It tells us who's most vulnerable. So we do know that it is men aged 35 to 44, single workers, non-immigrants, those unemployed but looking for work, younger workers entering high-risk subsectors, and specific subsectors in the self-harm and drug-related hospital encounters has been structure and building exterior construction. This is a message that we've been sharing with all of our trade partners. And again, I encourage everybody on the call, if you do know people in this space, share alike. Next slide. Thank you very much. We've all talked about the resources. I just did want to throw up these. I agree with everybody who's pointed towards the amazing work that Kathy and the IHSA have done in building their websites, in the podcasts, in every form of media, toolbox talk that they've drawn research from. It's been amazing. Again, absolute props for IWH and their research-based approach. It's not just mental health, anything OC health and safety. There's a phenomenal amount of resource there that will help build a foundational level of understanding in that psychosocial space as well. And finally, there is more data, including the data that I've shared previously through that QR code on the screen right now, and that's from that roundtable. But also, beyond this, organizations like Medcore, Hard Hats provide excellent programs and support networks. They're just a couple of people that we've connected with, and they're absolutely outstanding. And now I'm going to hand it over to Irina to share what we're doing at Multiplex specifically. We don't have all the answers, but we are committed to learning, improving, and doing our part to create a safer, healthier industry for everyone.
Thank you, Mark. Hello, everyone. My name is Irina Ten, and I'm a senior HR manager with Multiplex. So it's really great to be here and have these important conversations around mental health. And today I'll share our mental health journey over the past 5 years. So somewhere around in 2020, we faced a tragic wake-up call when a construction worker died by suicide outside of work. But still, it was very, very deeply, it impacted us very deeply. And it created urgency to act. We immediately engaged our AAP provider for on-site crisis support and group debriefing session, helping employees process and heal. So this led us to ask, what more can we do? Where should we start? At that time, stigma around mental health, especially in construction, was very high. I mean, it's still high, but at that time, it feels like it was even higher. So we launched a mental health awareness road show to educate employees, reduce stigma, and start the conversation. During this roadshow, we invited volunteers to become mental health first aiders, and their responses was incredible. A lot of people put up their hands and joined the team. We then formed a mental health committee, which later evolved a little bit into a smaller agile working group to keep initiatives moving. We partnered with Canadian Mental Health Association and our mental health coaches to provide ongoing support and training for first aiders. And we're building a peer support network for sharing experience. Recognizing the unique challenges faced by on-site staff, we extended a peer service to our union staff as well. We know that union provides their benefits, but we made a decision to extend our program to union staff as well. And we're in a communication campaign to ensure that everybody is aware and know how to access these services. So earlier this year, we brought our working group together to identify priorities and create our 2-year mental health strategy. It's built around our 4 pillars, which I'll share with you in one slide. Can you please move to the next one? So before sharing a strategy, I want to emphasize why mental health matters for us as an organization. It's not an internal initiative, it's embedded in our broader commitments. So it's a top priority for our people strategy, global and locally. So for those who don't know, Multiplex is a global construction company. So this is part of our people strategy. Mental health is also a key focus under the people pillar of our ESG strategy. ESG is not only about environment and government, it's about how we care for people. By making mental health a strategic priority, we are signaling that this is not optional, it's part of how we operate and how we measure our success. Can you please move to the next slide? Okay, here's our 2-year mental health and wellness strategy. So the purpose is to create a workplace where people feel safe, supported, and empowered to bring their whole selves to work. We identify 4 major or 4 priorities or focus areas. The first one is to increase awareness and understanding of mental health across the organization. Second is foster psychologically safe workplace and supportive culture where people feel comfortable to speak up. Third is implement mental health and wellness practices. And the last one is promote mental health and wellness resources. Like today through the panel and other feedbacks we're hearing, people very often just don't know what resources they have available with the current providers we're having now with the company. So next I'll dive into the next each of the focus areas. One of the top priorities has been increased awareness and understanding of mental health and wellness across the organization. So what did we do? We started by improving communication. We created a dedicated mental health page on our intranet page and with resources, information, and support options. We also shared reminders for key dates like posters, videos, newsletters, and make sure these messages were easy to find and relevant to everyone. One of the biggest highlights of each year for us is Mental Health Week. We align our activities with Canadian Mental Health Association's annual theme. During that week, we host in-person sessions and interactive events so everyone can participate. The goal is simple: raise awareness, reduce stigma, and promote mental health well-being. And it doesn't stop there. So throughout the year, we organize other important mental health related events to keep the conversation going. It's all about making mental health a priority every day, not just during this week. Next slide, please. Our next pillar is about building a safe, supportive culture. Leaders play a critical role in promoting mental health and well-being across all teams. Today, almost half of our leadership team are fully trained mental health first aiders. They actively support and participate in mental health initiatives throughout the year and lead by example. We provide annual support sessions for mental health first aiders to keep them equipped. These sessions, facilitated by external experts, focus on particular tools for managing conversations, recognizing early warning signs, and creating space for sharing experience. So looking ahead, we plan to strengthen peer support systems by creating a more structured approach that connects employees and ensure they have access to help when they need. Another key priority for next year is training all people managers on mental health and well-being. While we already provide education and resources, we know that managers sometimes struggle with what to say, how to navigate sensitive conversations and situations. Our goal is to give them the knowledge and tools to have these conversations confidently and recognize early signs of concern with their teams. And finally, we work closely with our global and local diversity networks, such as Neurodiversity Resource Group and the Women's Network, because different communities may face unique mental health challenges. Engaging this group helps us understand their needs, and importantly, this is also strengthens our mental health initiatives while fostering a culture of inclusion across the organization. Next slide, please. Our next pillar is about implementing mental health and awareness practices across the organization. One of the key steps we've taken is incorporating health and wellness objectives into our annual performance process. So all of us have at least one well-being goal for the year as a part of their performance plan. We also make mental health priority in our monthly one-on-one sessions between managers and employees. The very first question during that conversation is always about how they're feeling, whether everything is okay, or if they need any support personally or professionally. It's simple but powerful way to check in on mental health regularly. Flexibility is another important part of this pillar. While we have certain limitations as a construction company, we still have some flexible options to offer, like flex hours or working from home option when people need that to balance their work and personal commitments. Education is equally critical. We partner with providers from our benefit programs and external vendors to deliver sessions on mental health and well-being. These sessions give employees practical tools and resources to support themselves and others. Next slide, please. Our final pillar is about promoting mental health and wellness resources. We provide a variety of benefits options and discount to support employees whenever we can. One key resource is our employee assistance program, which offers both online and in-person support for mental health and well-being. We regularly remind employees and managers about these resources because we found that, well, sometimes people just don't know what they have to use. So the clear communication is really essential here. We also offer an in-house reimbursement program for health and wellness items, such as fitness, nutrition, and other activities that support overall well-being. These guidelines are updated regularly so employees know what is available for them. In addition, we encourage employees to use our enhanced mental health benefits, which is included in our group benefits plan. We offer, I would say, pretty generous annual allowance of $3,000 per year per person, and they also, dependent of their person, have the same allowance of $3,000 for a year to use for mental health. If they need any help, any support, they can engage therapists and use this balance towards that. We also provide 5 paid sick or personal days for people if they need to be off work due to their mental or physical health, just to have them an opportunity to take this break without any negative effect to their pay. Beyond that, we've introduced wellness programs that cover physical fitness, nutrition, and financial well-being, also stress management. And my last slide. So before finalize what I just said, I'd like to share QR code with you, which we used for our team. This code links to our mental health awareness guide. And this guide includes tips for de-escalating situations, mindfulness, breathing, exercise, and anxiety first aid kit, as well as resources and support options you can access anytime. That's it. Thank you.
Perfect. Thank you, Mark and Irina. It's great to see an organization that prioritizes mental health and puts their employees first the way that you guys do. I think we have time for one quick question, if that's okay with you guys. So how or what do you know now that you wish you knew at the start of your efforts? So what's one piece of advice you would give a company that's wanting to build a mental health strategy like Multiplex has?
I'll go first. I'm sure Irina has a point. I think it's always important to look externally. But I think it was something that Andrew spoke about at the top about the vulnerability. Um, like go to your peers. You know, if you've got connections within your network, go and ask the question. Look, we're a big organization, but we don't know everything. You know, you got to be humble in this space, in the people space. I think it's vitally important, and I think yeah, if looking back, I think if we had gone out a little bit more and knocked on a few more doors, I think we would have got to where we got a lot quicker. Irina?
Yeah, I think what helps, like in my role specifically as HR, I'm connected with people very often and consistently. So first point of contact, if anything comes to mental health or any well-being questions. So it really helps to understand the people's needs and what actually they need. Because they come to you very openly and being vulnerable to share that. Have this open conversation and be open to hear. So I think if we do it now, would be, I guess, really that people actually need that, because when we started, which was like, you know, a lot of hesitation, people were very not comfortable talking about that. But once you get to the point and being vulnerable with them and talking with them, they understand and being more open to the message you want to deliver and what you want to actually achieve through your actions. So in terms of the mental health support. So yeah, just don't underestimate the need of people. Actually contact with them and connect with them and ask questions, be curious. So that really, really helps to put together a strategy or plan for yourself that actually would meet the expectations of your team.
Perfect. Well, thank you both for being here. We really appreciate you guys presenting today. You are a very big leader in this topic in our organization. So it's nice to see what you guys are doing firsthand. So thank you for being here.
Thank you.
Thank you.
Just going to do a quick closing. So I just want to thank everybody who joined us for the 7th annual Mental Health and Addictions in Construction webinar. So we've heard some powerful insights from the current state of mental health to the support available and to how a leading organization is putting these practices into action. So a big thank you to our speakers who not only highlighted the challenges we still face in mental health within our industry, but as well as the opportunities that we have to diminish the stigma and create a healthier, more supportive, and accommodating industry as a whole overall. And a big thank you to our sponsor, Sherrard Coos. So we will have a post-event summary going out with the recordings and all the resources that we have collected from this webinar. So we thank everybody for sharing those resources, and we will have those out to you as soon as possible. And we just want to thank everybody today for being a part of this conversation. And we hope that you continue this conversation because, as we heard, mental health isn't a side issue within the construction industry. It's a core part of safety, culture, and the long-term strength of our workforce. So thank you for all being here today. Have a good day.